First, let me say to you that the ministry is still in shock, especially her colleagues whom she was working with and was living with. We're still in shock. As you know, every nurse is important to us. Last year, to the ending part of last year, I'm not sure whether it was November or December, she was deployed. But one of those 2 months, she was deployed to Madia. And I want to say this, nurses, like many other nurses, they would be asked to help out with the situation in one region or the other. And I'm quite certain that she loved what she did so much, that she volunteered to go and help the people in region number 8. And so that is nothing, what has happened, what has transpired, is nothing easy for us. And likewise, I'm quite certain her colleagues too. So let me take this opportunity to say to the entire health fraternity that we must not give up hope. We must build on what Nurse Shanizi has left, and let us make her proud. And at this juncture, when there is so much available to Nurse Shanizi, and for us to lose her in this manner, in a manner where she was not ill, it was not expected, it really saddens a lot of us in the ministry, or I should say the entire public health sector, because various persons are calling, they have been emailing, there have been discussions with staff about this incident which took place. And so let me take this opportunity to express our profound condolences to the parents of Shanice, Nurse Shanice. A few things are happening. There are quite a few investigations going on. I spoke with the dad the very evening when this matter happened. I spoke with the director of regional health services, and we internally would have launched an investigation, and we know the police is also investigating this matter. And so we are awaiting those results from those investigations. I know many people, all of us, we want to hear as quickly as possible, but I always believe in allowing due process to take its place. And so I am awaiting those internal and external results from the investigations. I would just like everyone to know that not to bother with the talkings on Facebook and other social media. Talk is cheap. But you have to be in the health sector to understand how the demise of Nurse Shanice will affect all of us here. Just Friday, we had an opening of a new annex. And I can tell you, that morning I received a long letter, you can say, from the chief nursing officer about Shanice's demise and how it has impacted her. And so this is not a walk in the park. Let me say that. This is not a walk in the park. I'm going to meet with the Minister of Public Security this afternoon, and I will have a discourse with him in terms of the investigations by the police force so that we can be able to help the family to bring closure. And wherever there is need for the police to take action, that we have those actions taken swiftly. I just trust that we will stand with the family, stand with the nurses, stand with the doctors in this moment of grief. From what I was told from her superiors at the hospital, that Nurse Shanice was the live wire, that since she got to Madia, she just stirred things up in a positive way.
I know this is a very traumatizing situation. It was something that no one never really expected to happen. In fact, based on my um, employment here at the Ministry of Public Health from 2015, this is the first case I would have known about that would have been deployed to a hinterland area, and there is it, that person was found dead in their apartment or the hostel. But this should not be used as a tool to discourage other young professionals from being deployed. Uh, every case, you have to investigate it on an individual basis. Of course, we would have to be more vigilant with persons who are being sent on deployment, right? To ensure that every system is in place in dealing with them. Also, we would have recognized from the Ministry of Public Health's point of view that the nurses were very, very traumatized. The nurses from the hostel, and by extension, the nurses from the hospital. So a system was put in place whereby those nurses were taken out of Region 8 on Thursday, and of course they were taken to Georgetown Hospital and the mental health unit, whereby they were exposed to counseling sessions to help them.